This presentation delves into the innovative approaches to treating PTSD in veterans using psychedelics. We will cover the definition and symptoms of PTSD, the role psychedelics could play, recent clinical trials, and the ethical and legal implications surrounding this evolving treatment method. We will begin by understanding PTSD in veterans, discussing its symptoms and prevalence. Next, we will introduce psychedelics, exploring their types and mechanisms in the brain. We will then review recent clinical research, followed by ethical and legal considerations. Finally, we will look at future directions and the potential impact of these treatments. Post-traumatic stress disorder, PTSD, is a mental health condition triggered by experiencing or witnessing traumatic events. Veterans are particularly susceptible due to combat experiences, making it crucial to explore effective treatment options. PTSD is characterized by symptoms such as flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the traumatic event. Understanding these symptoms is essential for treating veterans suffering from this disorder. PTSD is a significant issue among veterans. Studies indicate that around 11 to 20% of veterans who served in the global war on terrorism suffer from PTSD in a given year. The prevalence is even higher among Vietnam War veterans, with about 30% experiencing PTSD at some point in their lives. Understanding and addressing this issue is crucial for providing adequate support and care. Traditional treatments for PTSD typically include psychotherapy, such as cognitive behavioral therapy, CBT, and medications like SSRIs. However, these methods do not work for everyone, leading to interest in alternative therapies. Veterans Affairs offers a variety of treatment options for veterans. These include mental health services, such as counseling and therapy for PTSD, depression, and anxiety. Veterans can also access medical treatments for physical injuries, rehabilitation programs, and substance abuse treatment. Additionally, the VA provides access to specialized care for conditions like traumatic brain injury and offers support programs for veterans' families. This was often overlooked in the past, but more recently family participation is incorporated into the treatment plan. The VA Crisis Hotline provides crucial support for veterans in distress. Available 24/7, it offers confidential help through phone, text, and online chat. Trained responders, many of whom are veterans themselves, assist with various issues, including mental health crises, suicidal thoughts, and other immediate concerns. The hotline ensures veterans get the care they need in times of crisis. Psychedelics are substances that alter perception, mood, and cognitive processes. This section will introduce their types, give some historical context, and discuss how they interact with the brain to potentially alleviate PTSD symptoms. Psychedelics have been used for centuries in various cultures for healing and spiritual purposes. Their historical usage provides context for their potential therapeutic applications in modern medicine. Common psychedelics include MDMA, known for enhancing emotional connections, and psilocybin, found in magic mushrooms, which may promote new perspectives on trauma. Each substance exhibits unique properties that could aid in therapy. Psychedelics work by interacting with serotonin receptors, particularly the 5-HT2A receptor, which can lead to altered consciousness and emotional release. This mechanism may help in processing trauma and fostering healing. Recent clinical trials have shown promise in using psychedelics to treat PTSD. This section will delve into recent studies, methodologies, participant criteria, and the outcomes observed in these investigations. Recent studies indicate that psychedelics, especially MDMA, can significantly reduce PTSD symptoms after just a few sessions. This highlights the potential of psychedelics as a viable treatment alternative. Clinical trials typically involve a controlled setting, where trained therapists guide participants through their experiences. Criteria for inclusion often focus on veterans with diagnosed PTSD and prior treatment failures. The results from clinical trials have shown that participants often report lasting improvements in PTSD symptoms, enhanced emotional well-being, and a greater sense of connection with others, indicating the effectiveness of psychedelics in treatment. As interest in psychedelic therapy grows, so do the ethical and legal implications. This section examines the current legal status of psychedelics, ethical concerns surrounding their use, and potential regulatory pathways. Currently, many psychedelics are classified as Schedule I substances in the U.S., limiting research and therapeutic use. However, there is a movement towards reevaluating their legal status based on emerging research. The use of psychedelics raises ethical questions regarding patient consent, the potential for misuse, and the importance of ensuring supportive therapeutic environments during treatment. Regulatory bodies are beginning to establish frameworks for the medical use of psychedelics. Understanding these pathways is crucial for the future of psychedelic therapy in treating PTSD. Exploring the future of psychedelics in PTSD treatment could open doors to wider applications. This section discusses potential barriers, broader implications for mental health care, and the hope they offer to veterans. The successes seen with veterans could pave the way for using psychedelics in treating other mental health conditions, such as depression and anxiety, broadening their therapeutic potential. Despite the promise of psychedelic therapy, barriers such as stigma, legal restrictions, and lack of widespread training for therapists remain significant challenges that need to be addressed. For many veterans suffering from PTSD, the potential of psychedelics to provide hope and healing is profound. Continued research and advocacy for these treatments may lead to transformative outcomes. The exploration of psychedelics in treating PTSD among veterans represents a promising frontier in mental health. By understanding the complexities involved, we can work towards developing effective and compassionate treatment options for those in need.